Inflammation is one of those words that gets thrown around constantly in health conversations, but very few people truly understand what it is, why it exists, and how it can quietly shape your long-term health. To really grasp why inflammation matters, we have to start with a simple but critical idea. Inflammation itself is not the enemy. In fact, without inflammation, you would not survive even minor injuries or infections. At its core, inflammation is a biological defense mechanism. It's part of your immune system's rapid response team. When your body detects a threat, such as bacteria, a virus, a toxin, or physical injury, it triggers a highly coordinated inflammatory response. Immune cells rush to the affected area, blood vessels dilate to increase circulation, and signaling molecules called cytokines send messages that help eliminate the threat and initiate repair. This is acute inflammation, and it's essential for healing. Think about what happens when you cut your finger. The area becomes red, swollen, warm, and sometimes painful. Those are classic signs of inflammation. What you're seeing is increased blood flow, delivering immune cells and nutrients, while damaged tissue is being cleared away. Once the job is done, the inflammation resolves and the tissue heals. This process is tightly regulated and incredibly efficient when everything is working as it should. The problem begins when inflammation doesn't turn off. Chronic inflammation is fundamentally different from the short-term protective inflammation that helps you heal. And instead of resolving in hours or days, chronic inflammation can persist for months or even years. It often operates at a low level, below the threshold of obvious symptoms, quietly damaging tissues and altering normal cellular function. This is the kind of inflammation that has been linked to many of the most common chronic diseases we see today. Research consistently shows that chronic inflammation plays a role in cardiovascular disease, type 2 diabetes, cancer, neurodegenerative diseases like Alzheimer's, autoimmune conditions, and even depression. It also accelerates biological aging. In other words, inflammation isn't just something that happens when you're sick. It can shape how fast you age and how resilient your body is over time. One reason inflammation is so powerful is because it affects nearly every system in the body. Inflammatory signaling molecules influence insulin sensitivity, mitochondrial function, gene expression, and even how your brain processes information. When inflammation becomes chronic, these signals can disrupt normal metabolic pathways, impair immune balance, and push cells into a constant state of stress. What's especially important to understand is that chronic inflammation doesn't always come from obvious sources like infections or injuries. Modern lifestyles introduce a wide range of inflammatory triggers that our biology wasn't designed to handle. Long-term, highly processed foods, excess refined sugars, industrial seed oils, chronic psychological stress, poor sleep, physical inactivity, environmental toxins, and even social isolation have all been shown to promote inflammatory signaling. Another key driver is visceral fat, the type of fat that accumulates around internal organs. Visceral fat is metabolically active and releases pro-inflammatory cytokines into the bloodstream. And this means that excess body fat isn't just stored energy, it's an active contributor to systemic inflammation. The immune system itself can also become dysregulated. Instead of responding only to real threats, it may remain partially activated, continuously releasing inflammatory signals. Over time, this creates a feedback loop where inflammation begets more inflammation, further impairing normal immune function. What makes inflammation particularly dangerous is how invisible it can be. You don't always feel it. You might not experience pain, swelling, or fever. Instead, the effects show up slowly. As insulin resistance worsens, blood vessels become less flexible, cognitive function declines, or cellular repair mechanisms lose efficiency. Understanding inflammation is the first step toward understanding why lifestyle choices have such profound effects on health. When you learn how inflammation works, you begin to see why nutrition, sleep, exercise, and stress management aren't just wellness buzzwords. They are biological signals that directly influence whether inflammation resolves or spirals out of control. To understand why inflammation has such a profound impact on health, we need to zoom into the cellular and molecular level. This is where inflammation stops being an abstract concept and becomes a powerful biological force that can either protect your body or slowly undermine it. Inflammation is driven by signaling molecules, many of which belong to a group called cytokines. Cytokines act like text messages between cells, telling the immune system when to activate, where to go, and how intense the response should be. Some cytokines are pro-inflammatory, meaning they amplify immune activity, while others are anti-inflammatory and help resolve the response once the threat is gone. Health depends on balance between these opposing signals. One of the most important molecular pathways involved in inflammation is called NF-κB. This pathway acts like a master switch for inflammatory gene expression. When activated, NF-κB enters the cell nucleus and turns on genes that produce inflammatory cytokines, adhesion molecules, and enzymes that generate reactive oxygen species. In the short term, this is useful. It helps immune cells respond quickly to danger, but when NF-κB is chronically activated, it keeps inflammatory genes turned on continuously, even when there is no real threat. Another major player is the inflammasome, a protein complex inside immune cells that senses cellular stress and damage. The inflammasome is activated by things like oxidative stress, mitochondrial dysfunction, excess glucose, and even cholesterol crystals. Once activated, it triggers the release of potent inflammatory molecules such as interleukin-1 beta. These molecules can spread inflammation throughout tissues and into the bloodstream. Mitochondria, the energy-producing structures inside your cells, are also deeply connected to inflammation. When mitochondria are functioning well, they produce energy efficiently with minimal oxidative stress. But when they become damaged due to poor diet, lack of exercise, toxins, or aging, they release signals that activate inflammatory pathways. In this way, mitochondrial dysfunction and inflammation reinforce each other in a vicious cycle. Inflammation also interacts closely with metabolism. Chronic inflammatory signaling interferes with insulin signaling pathways, making cells less responsive to insulin. This is a key mechanism behind insulin resistance and type 2 diabetes. Inflammatory cytokines can block glucose uptake into muscle cells and promote excess glucose production in the liver, keeping blood sugar levels elevated. At the level of blood vessels, inflammation damages the endothelial cells that line the arteries. These cells normally regulate blood flow and prevent unwanted clotting. Chronic inflammation makes the endothelium more permeable and sticky, allowing immune cells and cholesterol particles to penetrate the vessel wall. Over time, this contributes to the formation of atherosclerotic plaques, which increase the risk of heart attacks and strokes. The brain is not immune to inflammatory signaling. In fact, neuroinflammation is now recognized as a major factor in cognitive decline and neurodegenerative disease. Microglia, the immune cells of the brain, become activated in response to inflammatory signals from the body. When this activation becomes chronic, microglia can damage neurons, impair synaptic function, and disrupt communication between brain cells. This helps explain the link between chronic inflammation and conditions like Alzheimer's disease, depression, and anxiety. What's particularly striking is how inflammation can alter gene expression without changing your DNA sequence. This happens through epigenetic mechanisms. Inflammatory signals can add or remove chemical tags on DNA and histones, proteins, effectively turning genes on or off. Over time, this can lock cells into a pro-inflammatory state, even after the original trigger is gone. And this molecular perspective helps explain why inflammation is so deeply tied to aging. As we age, inflammatory signaling tends to increase, a phenomenon sometimes called inflammaging. The immune system becomes less precise, mitochondrial function declines, and cellular cleanup processes become less efficient. The result is a slow accumulation of inflammatory damage across tissues. Now that we understand how inflammation works at a cellular level, the next critical question is where chronic inflammation actually comes from in everyday life. For most people, it's not a single dramatic cause, but a collection of small, repeated signals that keep the immune system switched on just enough to cause long-term damage. One of the most significant drivers of chronic inflammation is diet. Highly processed foods, particularly those rich in refined carbohydrates and added sugars, can rapidly spike blood glucose levels. These spikes increase oxidative stress and activate inflammatory pathways such as NF-κB. Over time, repeated glucose surges damage tissues and promote insulin resistance, which further fuels inflammation. Another dietary factor is the imbalance between omega-6 and omega-3 fatty acids. Omega-6 fats, commonly found in industrial seed oils, are not inherently bad, but in excess they are converted into pro-inflammatory signaling molecules. Omega-3 fats, found in fatty fish and certain plant sources, produce anti-inflammatory mediators that help resolve inflammation. Modern diets often contain a disproportionately high ratio of omega-6 to omega-3, tipping the balance toward chronic inflammation. The gut plays a central role in regulating inflammation. Your intestines are home to trillions of microorganisms that interact with the immune system every day. When the gut barrier is healthy, it selectively allows nutrients to pass into the bloodstream while keeping harmful substances out. But poor diet, chronic stress, infections, and certain medications can disrupt this barrier. When this happens, bacterial components like lipopolysaccharides can leak into circulation, triggering systemic inflammation. This process is sometimes referred to as metabolic endotoxemia. Excess body fat, particularly visceral fat, is another major contributor. Fat tissue is not just passive storage. It actively secretes inflammatory cytokines. And as fat cells enlarge, they become stressed and attract immune cells that further amplify inflammatory signaling. This creates a self-reinforcing loop where inflammation promotes fat storage and fat storage promotes inflammation. Chronic psychological stress is often underestimated as an inflammatory trigger. Stress hormones like cortisol and adrenaline are useful in short bursts, but when stress becomes constant, these hormones disrupt immune regulation. Chronic stress increases the production of pro-inflammatory cytokines and impairs the body's ability to shut down inflammatory responses. This is one reason why long-term stress is associated with higher risk of cardiovascular disease, metabolic disorders, and mood disturbances. Sleep is another powerful regulator of inflammation. During deep sleep, the body performs critical repair processes, including the resolution of inflammatory signaling. Sleep deprivation, even for a few nights, increases levels of inflammatory markers such as C-reactive protein and interleukin-6. Poor sleep also disrupts glucose metabolism and appetite regulation, indirectly increasing inflammatory load. Physical inactivity contributes as well. Regular exercise has potent anti-inflammatory effects, partly by improving insulin sensitivity and mitochondrial function, and partly by stimulating the release of anti-inflammatory molecules called myokines from muscle tissue. When physical activity is absent, these protective signals are lost and inflammatory pathways become more dominant. Environmental exposures also matter. Air pollution, cigarette smoke, heavy metals, and certain chemicals can directly activate inflammatory pathways and damage mitochondria. Even low-level chronic exposure can accumulate over time, adding to the overall inflammatory burden. Importantly, many of these factors don't act in isolation. They interact and amplify each other. Poor sleep increases stress hormones, which disrupt gut health, which worsens inflammation, which impairs metabolic function, which then further disrupts sleep. This interconnectedness is why chronic inflammation can feel so difficult to escape once it becomes established. Once you understand where chronic inflammation comes from, the conversation naturally shifts from awareness to action. The encouraging reality is that inflammation is not a fixed state. It is highly dynamic and remarkably responsive to lifestyle interventions that send the right biological signals to your cells. Nutrition is one of the most powerful tools for modulating inflammation. Diets rich in whole, unprocessed foods consistently reduce inflammatory markers. Vegetables, especially cruciferous vegetables like broccoli and Chelae provide compounds such as sulforaphane that activate cellular defense pathways and suppress NF-κB signaling. Polyphenol-rich foods, including berries, olive oil, green tea, and dark chocolate, neutralize oxidative stress and reduce inflammatory gene expression. Protein quality also matters. Adequate protein supports muscle mass and metabolic health, which indirectly lowers inflammation. Fatty fish like salmon, sardines, and mackerel are particularly valuable because they provide omega-3 fatty acids, EPA and DHA. These fats are converted into specialized pro-resolving mediators that actively turn off inflammation rather than simply blocking it. The timing and consistency of eating can influence inflammation as well. Periods of fasting, whether through time-restricted eating or occasional longer fasts, give the body a break from constant nutrient processing. This allows cells to activate repair mechanisms like autophagy, which clears damaged proteins and organelles that would otherwise trigger inflammatory responses. Exercise is another cornerstone of inflammation control. Regular physical activity reduces visceral fat, improves insulin sensitivity, and enhances mitochondrial efficiency at a molecular level. Exercise activates anti-inflammatory signaling pathways and increases the production of antioxidant enzymes. Even moderate activity, such as brisk walking, has measurable anti-inflammatory effects when performed consistently. Sleep cannot be overlooked. High-quality sleep is one of the most effective ways to regulate immune balance. During deep sleep, inflammatory cytokine production decreases, and tissue repair accelerates. Prioritizing sleep duration and regular sleep timing helps normalize circadian rhythms, which play a key role in immune regulation. Disrupted circadian rhythms have been shown to amplify inflammatory signaling across multiple organ systems. Stress management is equally important. Techniques such as mindfulness meditation, controlled breathing, and regular exposure to nature have been shown to reduce inflammatory markers. These practices work by lowering sympathetic nervous system activity and enhancing parasympathetic tone, which promotes recovery and immune balance. Gut health deserves special attention. A diverse and fiber-rich diet feeds beneficial gut bacteria that produce short-chain fatty acids like butyrate. These molecules strengthen the gut barrier and directly suppress inflammation. Fermented foods such as yogurt, kefir, and kimchi introduce beneficial microbes that support immune tolerance and reduce excessive inflammatory responses. Environmental awareness also plays a role. Reducing exposure to air pollution, avoiding smoking, and minimizing contact with harmful chemicals can lower the inflammatory burden. And while not all exposures are controllable, small changes can have cumulative benefits over time. What's striking is that these interventions don't work in isolation. When combined, they create a powerful anti-inflammatory environment. Improved sleep enhances exercise recovery. Exercise improves stress resilience. Better nutrition supports gut health and metabolic function. Together, these changes shift the body from a state of chronic immune activation toward one of repair and resilience. When we step back and look at the bigger picture, inflammation emerges as one of the central forces shaping how we age and how long we remain healthy. It acts like a biological volume knob, turned up too high for too long. It accelerates tissue damage, disrupts normal signaling, and shortens health span. Properly regulated, it supports repair, resilience, and longevity. Aging itself is closely tied to chronic, low-grade inflammation, often referred to as inflammaging. As the immune system ages, it becomes less precise. It responds more slowly to real threats while remaining partially activated even in the absence of danger. Senescent cells, which are damaged cells that no longer divide, accumulate with age and release a cocktail of inflammatory signals known as the senescence-associated secretory phenotype. These signals spread inflammation to surrounding tissues, amplifying systemic immune activation. This inflammatory environment affects stem cells, reducing their ability to regenerate tissues. It impairs mitochondrial function, leading to lower energy production and higher oxidative stress. It also alters nutrient-sensing pathways that regulate growth and repair. Over time, these changes reduce the body's capacity to maintain itself, increasing vulnerability to disease. Cardiovascular disease provides a clear example of inflammation's long-term impact. It is now well established that atherosclerosis is not simply a cholesterol storage problem, but a chronic inflammatory process within the arterial wall. Inflammatory signals drive plaque formation, progression, and rupture. Interventions that reduce inflammation, independent of cholesterol levels, have been shown to lower cardiovascular risk. Neurodegenerative diseases also reflect the consequences of unchecked inflammation. Chronic neuroinflammation disrupts synaptic communication, impairs waste clearance in the brain, and promotes the accumulation of misfolded proteins. Managing systemic inflammation may therefore be a key strategy for preserving cognitive function as we age. What makes inflammation especially important is that it represents a convergence point. Many different risk factors, poor diet, sedentary behavior, stress, sleep deprivation, environmental toxins feed into the same inflammatory pathways. This means that improving inflammation often produces wide-ranging benefits across multiple systems simultaneously. From a practical standpoint, the goal is not to eliminate inflammation, but to restore its proper regulation. The body needs inflammation to heal and defend itself. The objective is to ensure that inflammatory responses are appropriate in magnitude, duration, and context. Biomarkers such as C-reactive protein, fasting insulin, and certain cytokines can provide insight into inflammatory status, but they're only part of the story. How you feel, how you recover from stress, and how resilient your energy levels are also reflect underlying inflammatory balance. The most empowering message is that inflammation is highly modifiable. Small, consistent choices compound over time. A nutrient-dense diet, regular movement, restorative sleep, and effective stress management do more than improve day-to-day well-being. They reshape the cellular environment in ways that slow aging and reduce disease risk. Ultimately, understanding inflammation gives you a unifying framework for health. It explains why so many chronic conditions share common roots and why lifestyle interventions are so powerful when applied consistently. By learning how to regulate inflammation, you're not just treating symptoms, you're addressing one of the fundamental processes that determines how well you live and how long your body remains capable, resilient, and adaptable.